number of Australians delaying or even avoiding seeing their doctor because of the rising cost of medical care has soared by almost 50%. And new figures released by the Productivity Commission report have not only detailed the impact of mounting out-of-pocket medical costs for Australians, but in many parts of Australia, people have also been on waiting lists for public dental care for years. Well, join us today to discuss the unacceptable state of public dentistry, not only here in Victoria, but nationally, is the CEO of the Victorian branch of the Dental Association and Associate Professor Matt Hopcroft. Welcome, Matt.
Yeah, great to talk to you, Michael.
Now, the Productivity Commission's report is a damning indictment on the state of healthcare in Australia, especially around dental health, with many Australians not having seen a dentist for years. Now, is that because of costs, or are there other factors in play, and what needs to be done, do you think?
Yeah, it's a really good question, Michael. I mean, clearly cost is a big barrier for a lot of people to access dental care. We know from a lot of data that only about 50% of Australians would visit a dentist on an annual basis. And one of the reasons that a lot of people say they can't access a dentist is because of cost. There are other problems. You know, there's anxiety, there's fear of the dentist, and there's important work that we need to do there. But if you think about healthcare costs, healthcare is really expensive. You know, healthcare in a hospital is expensive, healthcare at a doctor's expensive, but that's predominantly subsidized by the government, and Medicare funds all of those services. But Medicare doesn't do the same for dentistry, so patients have to pay that out of pocket themselves. We have state-funded public dental services around Victoria and around Australia, but here in Victoria, the average waiting time is 27 months because it's so poorly funded. So, you know, it's not surprising that we see the dental problems that we see. And that's why it's such an important thing for us to elevate the importance of dental health and get governments at the state and at the federal level to be doing more to help people.
27 months, Matt, is there any dental condition that's not exacerbated by a 27-month wait, even the checkup?
Yeah, and you know, I think this is the piece that everyone misses about how important dental health is. Every dental disease, and tooth decay affects 1 in 3 kids by the age of 5 to 6. It's probably one of the most common diseases affecting adults. Gum disease, about 50% of people by the age of 55 to 70 end up with gum disease. It causes tooth loss. It impacts on our ability to eat, our nutrition. So there's these huge problems with neglecting oral health, and they all get worse if they're not detected early, but they're preventable if they're detected early. So if we can get people into the dentist regularly, we can minimize the impact. And then the other one that we often forget, but it's important to talk about, is oral cancers, which are probably about the 7th most common cancers. They're often found by dentists. You know, the John Farnham oral cancer just recently was detected by his dentist, and really important to go into the dentist for regular screening for those sorts of problems. So every time that we push back dental care, we delay it, we risk disease getting worse, and then we risk those outcomes for patients getting worse. We risk small tooth decay requiring a large filling or root canal treatment or extraction of the tooth. So prevention is really important. And when you're forcing people to wait 27 months for that first checkup for basic care, we see massive deterioration, and that's a really huge problem.
Now, I was shocked to read that tooth decay is the leading cause of preventable hospitalisation of our children.
It's outrageous. It is absolutely outrageous that that's the case. And it's been that way for a long time. And you know, I meet with politicians and policymakers all of the time, and you know, you throw those stats down onto the table, and people listen to them, but they're not then taking the action that's required. I mean, we shouldn't have kids hospitalised because they've got dental problems requiring extraction, requiring multiple teeth taken out. And I think the other bit that we're missing in all of this is it's costing our healthcare system elsewhere money. So when those kids are going into a hospital, that's costing the hospital system money. When people turn up to a hospital emergency department because they've got a toothache, because they can't get in to see the public dentist because the wait's too long, that's costing the hospital system as well. So we can save the hospital system money. And we've had this huge conversation over the last few weeks about Medicare falling apart and the problems that we see in the healthcare system. Well, we can take some of that burden off if we fund things like dental care more appropriately and get people seen sooner so that these problems don't get much, much worse.
Now, we introduced the childhood dental benefit schedule right back in 2014. I think it was under Abbott. Has that had an impact?
It has, and that's been a really important program. And there was some, moves afoot a long time ago to perhaps try and shut that down. And I think we successfully encouraged the government of the day to keep that going. Around about 50% of kids are eligible for the child dental benefit schedule. So it's for people with family tax benefit A. So if you've got people, listening to this, check to make sure that you're eligible. Kids get $1,000 worth of free dental care at either a public clinic or a private clinic, so you can go and see a dentist of your choice. And it's really helped to improve access to care for those kids. We need to promote it more. Not as many kids who are eligible are using it as they should, but that's a really, really valuable scheme, and it has opened the door for a lot of people to receive necessary care.
It's a great program in place as well, when children can get in and see their dentist for the checkup every 6 months done, and it gets them used to it, so that fear of the dentist goes away, and it sets a great example.
Absolutely, and embedding, some of those principles about, regular care, about looking after your teeth, about healthy eating and toothbrushing, and all of those things that will help to prevent disease down the future.
Now, we've seen some damning examples of the food industry impact. That we see what sugar does to teeth, the sugary drinks. We've also seen some great examples of Mexico's tax on sugar tax. Should we have a tax on this food to actually fund the children's dental benefits scheme and expand that to cover more children or more services? Because it would be a double-edged or a 2-for-1 deal, whereas if they can reformulate, which we found in Mexico, I think they found that they removed 35% of the sugar in these fizzy drinks. So they reformulated them with less sugar, but consumption dropped by around about 8%. Obesity dropped. It seems to be a win-win-win if we do.
Absolutely. Everywhere that they've implemented a tax or a health levy on sugary drinks, it's shown a benefit. And for those, two kind of main reasons, it shifts people's behavior. And we know that people are price sensitive, and taxes work. It's worked for tobacco to help reduce smoking. So it will help to reduce consumption. But it also, as you've said, encourages, if it's set up properly, encourages companies to reformulate their products. So that also helps to reduce sugar. We know that sugar is the driving force behind tooth decay. And when we say, 1 in 3 kids by the age of 5 to 6 have tooth decay, it's probably not sugary drinks, it's sugar in a whole lot of forms. But by the age of 12 to 14, it's about 40% of kids have tooth decay in their adult teeth. The average teenager has 20 teaspoons of sugar a day, 80 grams of sugar. So when you go home tonight, get the sugar jar out, put 20 teaspoons of sugar into a cup just to see how much that actually is. And about a third of that's coming from sugary drinks. So if we're not being serious about our obesity crisis and about our tooth decay crisis and about our diabetes crisis, then yeah, absolutely, let's keep doing nothing in this space. But if we want to really tackle these problems, then the evidence tells us that you're right, a levy on sugary drinks is a mechanism to help us down that healthy path.
I can imagine the frustration that you must feel when you see a lot of these health foods or the juices being promoted as, healthy weight loss shakes, juices. It must make you pull your hair out with the marketing messages around that and the acceptance of it on face value as, oh no, it's fruit juice, it must be good for me.
Yeah, and fruit juice is a really interesting one because it is marketed as being healthy, but it is really just a concentrated sugar drink. But it's the broader picture about what's happening with our food. Your breakfast cereals that might be 25 or 30% sugar, but they're marketed with 4.5 health stars, and so people assume that they're healthy. And then there's that broader marketing piece. So, you catch public transport around Melbourne and you see junk food advertised on the sides of trams or at train stops. You go to the football or the cricket and you see football stadiums just plastered with advertising for junk food, and it's that link between sport and what we consider to be healthy and a good thing to promote to kids is being linked to junk foods, and the kids can't kind of separate that out. So there's a huge amount of work that we need to be doing in this kind of space around marketing. And I think, we're a little bit older and we sort of think about traditional marketing, what's on the TV and what's in the newspaper. And now for our kids, it's what are they seeing on their phone? What's on the apps that they're using? And how do we then tackle something that's even more challenging for us because it's not always as visible to us as parents. So I think tackling the marketing bit is a really key piece for all of this.
Now, at the other end of the spectrum, we had the Aged Care Royal Commission recommended the establishment of a senior dental benefit scheme, which would help our older Australians access the necessary dental care. Is there any movement on that front?
Well, I hope so, and this is an area of particular interest to me. It's an area where I've done a lot of research previously, and we've highlighted the terrible amount of neglect for people living in residential aged care with their oral health. And there's definitely a need to establish, a similar scheme to the child dental benefit scheme, a senior dental benefit scheme that would allow people to access dental services. And again, for all of those benefits, it improves people's health, their well-being, their ability to eat and smile, but also to reduce other healthcare costs as well. Unfortunately, at the federal election last year, neither of the major parties sort of took that up as being a key policy idea. But we're certainly hopeful with ongoing, negotiations with the government at the moment that we can continue to push them to see this as being governments always say we're going to implement all of the recommendations of the Royal Commission of the day. Here's a really key one. Let's see some action on it.
Yeah, and as you said earlier, this goes to cost as well, the amount that is spent on reconstituted food, because a lot of our seniors have lost the ability to eat natural foods, and it just goes to dignity, being able to eat comfortably. Matt, the divide between GPs and dentists, why aren't they together? Why are they seen as separate? Because the GPs are getting some great traction at the moment. Dentists we're not hearing anything from, and it's just ridiculous.
Yeah, look, we're trying to have our voice heard, and I think it's a bit of a chicken and egg problem. I mean, because GPs are funded by Medicare, it's incumbent on the government to talk with them and to try and solve some of the really significant problems that we're seeing with Medicare and access to GPs and bulk billing. All of those sort of things are really significant problems. Because we don't have that same involvement with significant government funding, we're just not on the radar as a problem to fix. And so part of the challenge is how do we get more onto that radar? And it's the competing interest kind of argument that makes a lot of this really, really tough for us. And we can't neglect some of the other problems that are happening in healthcare at the moment, and they are really critical to fix. I think it's just really important that we continue to talk about this one issue as well as part of a broader set of problems. Because if we fix Medicare and GPs and access, but we do nothing in the dental space, then these problems are going to continue and still cause significant cost problems. But more importantly, it's the outcomes for patients. It's all of those hundreds of thousands, millions of Australians out there who are struggling to get access to care, whose health is compromised, whose well-being is compromised, because the government's not looking after them in the way that the government should.
Yeah. Now, one final question: like all industries, like everyone in the healthcare, workforces is always an issue for other things. If we increase access to the dentistry, is the infrastructure and the workforce there to be able to cope with it, or do we need a long-term plan where we need some sort of government intervention to set these clinics up and train the workforce in advance of doing it?
Yeah, really good question, Michael. And I think because we're in a stage now, as I said before, about 50% of people visit the dentist on a regular basis. Clearly, there's a large proportion of the population who need care that aren't getting it. And we've always cautioned against some of the calls that have come out, in the last decade or so about bringing all of dentistry into Medicare, because it would not be sustainable. And that's why we talk about gradual expansion of the child dental benefits schedule, for example, then moving to a senior dental benefit schedule, so that we can slowly start to build capacity and get a sense of where some of these problems might sit. About 85% of dentists and dental care is provided in the private sector. So again, it's really important to build a program or a mechanism that meets that reality. But at the same time, I think there's clearly a role for state governments to really build and enhance their public dental systems, their community health networks around the state, to ensure that mechanism exists. I think we do need both systems to work together and work quite effectively together. So, if we turned a tap on tomorrow and said, here's billions of dollars to fund more care for all Australians, that would be a problem. But I think if we can build slowly and sustainably, then it's certainly achievable.
Great. All right, Professor Matt Hopcraft from Dental as Anything. Thanks so much for your time.
Thanks, Michael.